What is the link between optic neuritis and MS? Imagine a sudden change in your vision, like a curtain falling over one eye or a flash of pain when you move your. That's often how optic neuritis begins. It's an inflammation of the optic nerve, which is the cable that carries visual signals from your to your brain. Now, this condition is strongly connected to a disease called multiple sclerosis, or MS. MS is a chronic illness where the immune system mistakenly attacks the protective covering of nerve fibers in the central nervous system, which includes the brain, spinal cord, and optic nerves. The link between optic neuritis and MS is both clinical and biological. For many people with MS, optic neuritis is one of the first signs. About a quarter of all MS patients report experiencing optic neuritis at some point. It usually affects one eye suddenly, causing vision loss and eye pain, especially when moving the eye. This happens because the inflammation damages the myelin sheath, the fatty layer that insulates nerve fibers. When the myelin is damaged, nerve signals slow down or stop, leading to visual problems. Both conditions share a common process called inflammatory demyelination. In optic neuritis, the immune system targets the optic nerve, causing inflammation and loss of myelin. In MS, this process happens in multiple parts of the brain and spinal cord. The damage to myelin and nerve fibers can lead to lasting visual impairment if not managed properly. If someone has optic neuritis, doctors often perform MRI scans to look for signs of demyelination in the brain. They may also analyze cerebrospinal fluid or conduct visual evoked potentials tests. These help determine if the inflammation is part of a broader process affecting the central nervous system, which would suggest MS. Many people recover from optic neuritis over weeks or months, especially with treatment. Corticosteroids can speed up recovery but don't change the long-term risk of developing MS. If tests show signs of ongoing CNS inflammation, doctors might recommend disease-modifying therapies to reduce future relapses and slow disease progression. From an eye health perspective, optic neuritis is different from other eye diseases like glaucoma or macular degeneration, which affect different parts of the eye. But it can cause lasting nerve damage, leading to permanent vision problems if the nerve fibers are severely damaged. People with MS might also experience other eye issues, such as side effects from medications or additional eye conditions, requiring careful eye care. In summary, optic neuritis is closely linked to MS because it often serves as an early warning sign and shares a common inflammatory process. Recognizing optic neuritis early and conducting thorough testing can help predict the risk of developing MS. It's important for anyone experiencing sudden vision changes to see a healthcare professional promptly for accurate diagnosis and appropriate management. Always remember, individual experiences vary, and personalized medical advice is essential for proper care.